think Access to Medicine Foundation is unique because it is coming at the problem from a number of different angles. From the one side, working with the companies to say, what are your difficulties? What are the constraints? It's also coming from the community aspect, from civil society's point of view, from the provider's point of view, to say what is needed, where are the gaps? And it's bringing evidence to the picture. And by, I think, coming at it from more than one angle, we really do begin to see solutions to the problems.
But actually, very concretely, Access to Medicine Index sharpened. It sharpened the awareness of what are the real challenges in those countries. And it's also actually a pretty good benchmark for what other companies are doing. So we're also looking at what are solutions that other companies develop, because in the end, if you want to improve access, it's not about a company solution. It has to be a solution that works for the patient and for the systems. So it's a mix of stealing with pride and using it concretely to identify either sharpening processes, making different decisions, starting different discussions, and very concretely for Roche, what Access to Medicine Index really helped is raising the awareness for the need to improve access in low and middle income countries and the challenges that they are facing.
It's impossible to talk about universal access if neglected populations are left behind. So bringing the pharma industry, the pharma sector, to work for those neglected populations, having the support of the Access to Medicine Foundation to keep the momentum and to keep the motivation of this sector with us, it's key not only for DNDi but for the global health community to achieve universal health coverage.
Being highlighted by the report, what it allowed us to do was identify gaps in knowledge that we at Biocon Biologics had in terms of registration, pre-qualifications, and how could we use that information to improve access to our medicines, to Biocon Biologics medicines in emerging economies, and improve awareness of Biocon Biologics products and brands in areas such as Sub-Saharan Africa. And to be honest, we have been very successful in this initiative, thanks to the report.
For us, the Access to Medicines Foundation has been really crucial in understanding what needs to change in the insulin space and diabetes care overall. The Access to Medicines Foundation Index, reports on insulin access, and convenings with our partners have been really crucial in understanding where our partners, particularly the private sector, doing really successful things that are impacting people, and where could they be doing more?
So Access to Medicine Foundation makes a huge difference in terms of furthering the agenda of accessibility to medicines by working with the pharmaceutical companies and pushing them to do more and evaluating what they are doing and quantifying that, which is a very important parameter in furthering access.
Indexes that the foundation works on is a sort of a competition. It creates an environment whereby you want to do better and you want to do more. It's a driver for health equity, it's a driver for positive change in the therapeutic landscape, and it's a driver to save lives, bottom line.